Mr. Speaker, it's that time of year when the first snow falls, the leaves turn brown, and pharmacist payment caps hit our healthcare system. Pharmacists may have to meet with patients multiple times to manage diabetes insulin, for example, and that work is unpaid. And despite population growth brought about by this government, Alberta is calling move-in bonuses, pharmacists' payment caps haven't changed in 7 years. Why does this government expect pharmacists to pay the price of this government's healthcare failures?
Good question. The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'm happy to say that our pharmacists have the greatest scope of practice of anywhere in Canada. Mr. Speaker, it's why we have more pharmacists per capita than anywhere else in Canada. And, Mr. Speaker, we are continually reviewing the payment with the RXA, which is the association that represents the pharmacists, making sure that they are, in fact, Mr. Speaker, paid appropriately for the work that they do. Mr. Speaker, that's a continual process that we go through on an ongoing basis, and we continue to do that each and every year.
Honourable member.
Mr. Speaker, given this government is happy to talk about pharmacists' scope of practice but does nothing to enable pharmacists to practice their full scope economically, and given that one of the many healthcare failures caused by this government is the 1 million Albertans without a family doctor, leaving the neighbourhood pharmacist as the only health provider, why won't this government sit down with pharmacists to pay them for the work that they do?
Good question.
Thank you, Mr. Speaker. We're going to continue to pay our pharmacists well because, Mr. Speaker, they are, in fact, one of the important members of the primary care team. But I'm happy to tell the member opposite that we have seen extreme growth in all our workforce area. In fact, Mr. Speaker, as of September 30th, we have 12,769 physicians registered to practice in the province. That's in comparison to when they were in office, which was only 10,600 at max, Mr. Speaker. And we continue to have more nurses, nurse practitioners, paramedics, etc.
Member for Calgary-Elbow.
Given that this government's anti-scientific obsession with fake health scares like chemtrails, electromagnetic allergies, and anti-vax conspiracy means actual health care challenges like measles, flu, and COVID go unaddressed, Mr. Speaker, and given this government's botched rollout of COVID vaccines means pharmacists are left explaining failed UCP government policies they themselves haven't had communicated to them, why is this government making pharmacists an accessory to their weird vision of public health rather than treating them like partners deserving respect?
Honourable Minister of Health.
Mr. Speaker, there was nothing in what the member opposite said that resembles accuracy, Mr. Speaker. In fact, Mr. Speaker, as of October 31st, we've had over 171,825 COVID vaccines administered to Albertans. This is very comparable to where we were last year at this time. Mr. Speaker, in terms of the vaccines that are being administered, the COVID vaccines that are being administered through pharmacy, they are in fact private COVID vaccines, and those are sourced by the pharmacists themselves.